Jenny, thank you so much for your patience. Let's cut to the chase. You were asking about natural killer cells and if the treatments Intralipid and Omegaven, something like it, if they work, and what actually helps for elevated natural killer cells. So I personally always like to look at the root cause, as you know. But let's talk about first Intralipids. That is an infusion made from soybean oil, egg, something, phospholipids, I think, and especially omega-6 fatty acids. It's used to suppress natural killer cells, and apparently it's supposed to actually fight inflammation. What I find surprising, because omega-6 elevates inflammation normally. Anyway, then the other thing, the Omegaven, whatever, is pretty much exactly the opposite. It's loaded with omega-3, and omega-3 is highly anti-inflammatory. And it has even in high dosages a little blood thinning effect. So the question now for me is, do they fix a problem? Do they mask the symptoms? What do they do? So Intralipid, I highly question. And there are studies, they say they can temporarily suppress natural killer cells, but high dosages in omega-6, what we are using already in our diets, is actually, generally speaking, a massive problem. So, well, again, not a doctor, but I personally, yeah. And usually, if they temporarily suppress natural killer cells, does it work in the long run? Because again, you don't want to get pregnant, you want to stay pregnant. So I'm not sure about this one. The other one, the Omegaven, different story, because it's a high dosage of omega-3, and omega-3 is highly anti-inflammatory. So because of that, I think that could actually work and do you a favor, because omega-3 help lower inflammation and they improve blood flow to the uterus. So yeah, that might actually work. But generally speaking, instead of just trying to suppress natural killer cells in the short term, why don't we address the root cause? And when we address this can actually help you to balance your immune system and calm those natural killer cells naturally down. So first of all, for balancing our immune system, vitamin D. Vitamin D is so important because low levels are linked to natural killer cells overactivity. So get out into the sun, please. And of course, we have omega-3. So EPA and DHA is important. It reduces inflammation, and so eating more fish, much more fish, especially the one low in mercury, can help. And if you don't eat enough fish, an omega-3 supplement in a higher dosage is definitely advisable. Another great supplement would be a combination out of resveratrol. Damn it, bad word. Resveratrol, whatever. And quercetin. And because those ones as well, they calm inflammation and that modulates the natural killer cell activity. And you don't have to grab a bottle there. Again, you can eat berries, red grapes, onions, because they contain the things that you will find in the supplement. Then, what is extremely important when it comes to natural killer cells, that you make sure you're not inflamed. So anything that causes inflammation within your body, unfortunately, you have to take it out of your diet. So if you know you can't handle gluten, don't limit, take it out. If you can't handle dairy, take it out. Anything and everything that can cause inflammation in your body, and that's unique to everybody, you shouldn't be handling and eating. And I repeat myself, do a food log, write down how you feel afterwards, and you will notice that your body is giving you signs and symptoms. And once you notice them, ask yourself, do I really want to feel like crap? Do I want to do this to my body, which is supposed to be my temple? Or can I let go of these foods? Food is there to nourish your body, not to make you happy. But it's not just about cutting out, adding in turmeric, ginger, wild-caught fish, leafy greens. They are important for your immune system and for your gut. And you could add obviously more probiotic-like food like sauerkraut and kimchi. And it's just about fueling your body with the food it actually likes. And that will rid you of inflammation and nourish your body, your whole body. And reducing inflammation means also reducing stress, because chronic elevated cortisol levels unfortunately lead also to inflammation. So go and meditate, do your daily mindfulness, breathe, and for heaven's sake, prioritize your sleep. If you don't do anything else, but prioritize your sleep. 7 to 8 hours per night lowers inflammation absolutely naturally. We also want to balance our hormones, because low progesterone allows natural killer cells to stay overactive. So hormonal balance is important. And the good news is we're doing all of that in our program. We also optimize thyroid function, because even just mild hypothyroidism can increase natural killer cells activation. And we also want to give our body key nutrients for immune balance, like selenium, because that calms inflammation and supports thyroid health. And we need zinc. We need that many nutrients for our immune function. And then it's not just about the nutrients. Also, our liver plays a role when it comes to natural killer cells. I'm so sorry, that topic is really long. But natural killer cells is pretty much, it's about fueling your whole body and looking after the whole thing. So again, the good news is that pretty much everything is addressed within those 12 weeks. And if you do what I tell you to do, you'll be fine, absolutely fine, and may not need Omegaven or Intralipids. May not. Anyway, was a bit of a longer video, and I will record now another one and look after my back, because it still hurts a lot.